So our next question, discuss the challenges faced by India in eradicating tuberculosis. What are the challenge faced by India? So our answer is okay. So now we find our best answer. So it is our best answer. Kimho. India set a target or it set a target to eradicate tuberculosis by 2025 ahead the global target of 2030. However, there is a long way to go in achieving these targets with an estimated 10 million new cases globally in 2017. With an estimated 10 million new cases globally in 2017 and India sharing almost 27% of the global burden of TB. So the main challenges under reporting of TB, India accounts for 26% of unreported cases and of TB estimated worldwide. This is despite TB being declared a notifiable disease and provision of the online reporting mechanism NICSA and NICSA and for medical practitioners. This is mainly because of stigma and misconception attached to TB, lack of incentives for reporting, penalties for not reporting by medical practitioners, lack of awareness, and undernutrition prevalent in India is one of the 5 factors that increase vulnerability to TB as per WHO, and lack of consistency in following treatment regime. Several patients of TB often miss doses or stop the treatment midway, and this can promote the emergence of drug resistance, leading to MDR TB or even MXDR TB. In addition to hampering recovery, lack of access to healthcare facilities and several areas prevents timely diagnosis and treatment. Emergence of drug-resistant strains of TB, MDR, and XDR TB make it difficult to control the disease. Way forward, recent measure by the government to make reporting mandatory by penalizing non-reporting and offering incentives for reported cases for step forward. Awareness campaigns and community engagement to eradicate people about the disease and end stigma, as well as inform them about government programs to prevent it. Follow up and monitoring it is necessary to ensure patients strictly avoid by the drug regimen and prophylactic treatment of vulnerable population like children under 5 years living in TB affected families needs to be extended, and proactive testing in endemic areas can help in early diagnosis and improved access to nutrition healthcare facilities overall is necessary, but extending coverage of PDS and primary health centers in remote areas. TB has emerged as a major health crisis, especially with the growing prevalence of drug-resistant strains. This makes it necessary to focus effort to control the disease. Very good answer. So I think it is the best answer. Need global partnership like BX TV Research Network, MDR TV needs. Okay, WTO's new guidelines for on the treatment of MDR TV needs to be adopted safely. So we for our containment of an infectious disease like TB within borders poses a considerable challenge. Hence, eliminating the disease is a pressing global priority. Else, the agenda of SDG to end the tuberculosis epidemic by 2030 is far from achievable. 5 factors of HIV/AIDS are diabetes, smoking, undernutrition, alcohol. HIV/AIDS and diabetes, smoking, undernutrition, and alcohol. Okay, so thank you.